Did you know that the most common reason I have patients stop Lisinopril is because they develop an annoying, dry, hacking cough? For some, it may be constant, life-interrupting thing, while others, it may be so subtle that only those around you notice and are getting annoyed by it. If this is happening to you, there may be some things that you can do about it. But that's not the only side effect you need to be aware of, so keep watching to find out more. Hi, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. In today's video, we're going to do an update on the medication Lisinopril and focus on some of the most common side effects and some things that you can do to avoid them. If you're looking for a more in-depth discussion on Lisinopril, you can click here where we give a more full discussion. Today though, we're going to keep it concise and get to the information that you're most interested in. Lisinopril overall is a great medication for most people. It tends to work well. It's simple to take since it's only once a day. It's cheap, overall it's really safe, and ultimately does well to prevent the problems of high blood pressure, including strokes and heart attacks. But none of that matters if you're having a lot of side effects when you take it. So let's go over what some of the most common ones are. As I mentioned in the beginning, the most common reason for somebody to stop this medication is that it can cause a dry tickle in the throat, which leads to a dry cough. This is not common but classic for this medication or any of the other medications called ACE inhibitors. There really isn't anything dangerous about the cough, it's just annoying. The most simple fix for this is you just stop the medication and we switch you to a different one. But there's also a lesser known treatment, however, that may help this go away and still be able to stay on it. There have been a few studies showing that taking an iron supplement of around 250 milligrams a day has been shown to lessen or even stop the cough. So talk to your doctor about either switching medications or taking an iron supplement if this is happening to you. Another common side effect is feeling faint or dizzy. This is usually a sign that medication is working too well and the dose may be too high. If you stand and start to feel lightheaded, then it's a sign that your brain isn't getting enough blood to it. If this is happening a lot, then talk to your doctor to discuss possibly changing the dose. If it happens within the first few days of starting the medicine, then sometimes it just takes a little time for your body to get used to it. So make a conscious effort to stand up slower and it should go away on its own. But if it doesn't, it means your blood pressure is probably too low and it may be time for a change. Other side effects that can affect you are some headaches, fatigue, impotence, and maybe some light sensitivity. These can be issues that may go away on their own, but if they're persistent, it may be a good time to talk to your doctor about other options to treat your blood pressure. So those are some side effects that, although bothersome, aren't necessarily dangerous. There are some things though that you need to be aware of that can be more harmful. The first is this medication works on your kidneys, and because of that, you do need to keep an eye on your kidney function. Now you usually don't have any symptoms with this, so it's something that with your doctor you need to be checking blood work. Usually you should check it about a month or so after starting the medication and then periodically after that. The most common issue we have with your kidneys is when people combine it with anti-inflammatories like ibuprofen or Aleve. You really should avoid taking these together as it can increase your risk of kidney damage. One of the other things your doctor should be checking is your potassium levels. In some people, you can see an increase in your potassium levels, putting you at risk for heart rhythm problems. So make sure you're keeping on top of that. Allergic reactions are always possible with any medications, but there is a type of reaction that can occur with these kind of medications called angioedema. This is most commonly seen as swelling of the tongue, lips, or face, but it can involve the airway as well, which can get dangerous. If you're noticing these symptoms, stop your medication and contact your doctor or seek care if you're having difficulty breathing. In rare cases, it can affect your liver, causing elevations in your liver enzymes, as well as it can affect your pancreas, causing a dangerous condition called pancreatitis. This is where the pancreas in your abdomen gets inflamed and can make you really sick. If you start having any symptoms of severe abdominal pain or nausea and vomiting while taking this medication, it's a good time to seek care and make sure everything is okay. Well, this isn't an exhaustive list of everything that can be known about Lisinopril, but it's a good overview of the most common issues that you should be looking for. If you're having a different experience with this medication and something seems off, then talk to your doctor about it. There are other different options out there, so don't be afraid to ask to change to something else. It's important though that we have the right perspective as we talk about these possible effects. The more serious ones are very rare, so it should not be something that you should keep you from taking it if your doctor thinks it's right for you. Well, we really appreciate you watching today and hope that you found this to be helpful. If you did, make sure to give this video a like and share it with your friends. It helps our channel to grow and reach others who may need this in their life. And please don't leave without subscribing and hitting that notification button so you don't miss out on any of our future content. Well, we appreciate you watching, and we'll see you in the next video.